We said we would dig into a bunch of the issues that came up in the first part of the conversation with President Ono. And I want to start with a question that has probably impacted all of you, which is the growing mental health challenges impacting young adults. And I want to see how this is playing out at the University of Michigan and what you're doing to address it. So Rob, let's start with you, given your role at focusing on health and critically wellness, which is obviously becoming a big issue on college campuses nationwide.
Well, student mental health has been a big issue for a long time, and you're right. I think there's been a lot of concern that it's getting worse. I think some of the contributing factors for why there's been concern, even before the pandemic, was a sort of a growing awareness that the local community couldn't support the needs of students, particularly a big school like ours, that students come from all over the place, and payment for mental health care can be really challenging. There's also been a trend, which I thought was unsolvable 20 years ago, which was stigma around help seeking. That's very different now and has contributed to an increased demand for some of these, what I'll call downstream services. And that's a positive when you've got a willingness to seek help or to help others, around you. The third has been an issue that students have long wanted to get in early and, get prompt service. So the issue for access has been a problem. So the model has often been short-term, brief intervention. But increasingly now, the students have been wanting longer-term treatment, and many students have more experience with mental health care before they come to campus. So we're much more savvy consumers of mental health services. So we're expecting more, at least come to campus with an awareness of the differences between these kinds of modalities. So we have been, like many places, adding mental health providers, and that hasn't seemed to move the needle. So during the peak of the pandemic, our institution, understanding that this problem may even become worse given the distress associated with the pandemic, charged a team from across the campus to think about innovative ways to address mental health care. And some of the suggestions that came out of that were best practices around some of these downstream resources and partnering with telecounseling services. But we've also, during that same time, adopted the Okanagan Charter, and that was really the charge to address the ecosystem and to really try and promote the entire place as a health promoting university as an upstream approach in an effort to try and reduce the drivers of distress at a policy and a systems level.